Go.
Knock, knock, knock. Hi, my name's Mercedes. I'm going to be your nurse today. Let's just go ahead and get you some privacy. Can I just get your name and date of birth? Awesome. And today the doctor sent me in to go ahead and give you some medications. So I'm going to go ahead and go over my 6 rights of medications with you. And that's going to be that I have the right patient, the right medication, the right route, the right dose, the right documentation, and that I'm giving the medication at the right time. The med that we're going to be giving you today is atenolol, and we're going to be giving you 50 milligrams of that, and you're going to take that once daily because that's the recommended dosage for adults. The action of this drug is that it's a beta blocker, so it's going to help reduce your blood pressure and your heart rate. The purpose of this drug is to reduce hypertension, angina, to help with your chest pain. It will also reduce arrhythmias, and it helps prevent against heart attacks. And side effects that you might encounter with taking this drug are dizziness, fatigue, bradycardia, or even shortness of breath. The onset of this drug is 1 hour. The peak action of this drug is 2 to 4 hours, and the duration of this drug is 24 hours. Drug interactions would be to not take this medication and then take other medications with it, such as ibuprofen, because it will lower the side effects of the atenolol, so don't do that. And the nursing implications for myself would be to check your heart rate and your blood pressure before administering the medication. And if it's below 50 beats per minute, I would hold the medication and I would not administer it. And I would teach my patient to take this at the same time daily. Do not crush your medication. This medication cannot be crushed. Don't take extra dosages of this drug. And do not stop taking this medication without consulting with your doctor first. Monitor your own heart rate and blood pressure at home before taking the medication. And avoid taking alcohol with this medication as well. And before giving this medication, I would run blood glucose level tests, potassium level tests, and I would also run sodium levels. And now that we've kind of gone over all of this information, do you have any questions or concerns already? And do you have any allergies that you're aware of? Excellent. So I'm going to go ahead and take your vitals. I'm just going to take your blood pressure and I'm going to put the O2 sat on you to get your heart rate. And so now that I've gone ahead and I've successfully completed that, I'm going to go over to my MRA and I'm going to unlock my med cart and pull out the medication that I need. And I'm going to compare it with my MRA and make sure that I have the right route, the right time, the right med, and I'm going to check the expiration date on my medication. And then I'm going to come back over to my patient. Can I just get your name and date of birth one more time? Excellent. And I'm going to double check one more time. Go ahead and scan my med into the MRA. Beep. And scan my patient's bracelet. Beep. And then I'm going to go ahead, now that I know I have the right medication, get one of those and lock that back into my med cart. And then I'm going to go ahead and give my patient this med orally. Would you like anything to drink or any oral care now that we've given you the medication? Okay. And then I would just sit with my patient and make sure that there are no side effects happening that shouldn't be happening, and I would document everything that I've done with the patient. Perform my hand hygiene, and we are all done. Alrighty, so my name is Mercedes. I'm going to be performing a subcutaneous injection today in the stomach for insulin. I have already donned my gloves and performed my hand hygiene. I went over my 6 rights of medication with my patient, and I also did my 3 checks for the meds. So first, I'm going to take an alcohol prep pad, and I'm going to wipe off my regular insulin, get a new one, and wipe off my NPH. And then I'm going to take my cloudy NPH and roll that for just a second. And then I'm going to uncap my needle. And I'm going to draw back 10 units of air. And then I'm going to add that into my NPH, take it back out, draw up another 10 units of air, put that into my regular insulin, and then draw back 10 units. Put it into the NPH, also draw back 10 units. Pinch the skin. Well, hold on. Recap your needle first. Grab another alcohol pad. Clean your stomach area. And now re-uncap your needle. Pinch the skin. And at a 45-degree angle, go ahead and add your units of insulin. Recap your needle with the scoop method. Put it in your hazard container. Don my gloves. And perform hand hygiene. My name's Mercedes. I'll be taking care of the patient today. I have gone over the 6 rates of medication. I have performed hand hygiene, did my 3 checks, and donned my gloves. So my first step is going to be to take this alcohol prep pad and I'm going to wipe off my vial, discard of that. I'm going to open up my needle and I am going to draw back the amount ordered of air first. And then I'm going to put it into my vial, add the air, flip my vial over, pull out the amount ordered, recap my needle with the scoop. Now I'm going to take a new alcohol prep pad, clean my area for my intramuscular injection, which we're going to do in the deltoid today. Now I'm going to reopen up my needle. And we're just going to go right in at a 90-degree angle. Slowly inject and pull straight back out. Recap our needle. Discard of that. Take off our gloves. Perform hand hygiene. And then we're going to inform the patient of any possible adverse effects. My name is Mercedes. Today I'm going to be performing an intradermal injection of a PPD. I have already identified the 6 medication rates, the 3 safety checks, and I identified my patient, performed my hand hygiene, and I've donned my gloves. So now my first step is going to be taking an alcohol prep pad, open that right up, clean off my vial, discard. I'm going to take my needle. Again, open that right up. I'm going to need that. And then I'm going to draw back whatever's ordered of air. Put that into my vial. I'm going to flip it over, pull back that same amount. Then I'm going to recap my needle. And I'm going to prep my forearm with an alcohol pad. Clean that nice and good. Let that dry off for a second. Re-pick up my needle. Take the cap back off. And then we're going to go in with the bevel up just under the skin. And then take that out. Recap the needle. Discard that in the biohazard container. Take my gloves off, perform hand hygiene, and inform the patient on adverse effects of the PPD. My name's Mercedes. I'll be taking care of the patient today. The doctor has ordered that we give insulin through a pen. So I've already went over my 6 medication rates. I performed hand hygiene and donned my gloves, and I did my 3 safety checks and identified my patient. So now my first step is going to be to take an alcohol prep pad, uncap my pen, clean the surface of it, disregard. We're going to open up the needle for the pen, screw that on there, and then I'm going to open a new alcohol prep pad, clean the surface, probably the stomach since we're doing that for injection, and then we'll uncap our needle, prime our needle, make sure it's working, and then we're going to turn to what the doctor ordered, And then we're just gonna go straight down till we hear a click and give them in. Pull out. Disregard of our needle. Okay. Take this off. We'll clean this and recap. And then we will disregard of our gloves and perform hand hygiene.